So thanks very much for coming. I thought I'd start off with some quotes coming from No Time to Wait, the Healthy Kids Strategy. It was a panel that was established to help Ontario achieve its goal of reducing child obesity by 20% in 5 years. And this is part of the Government of Ontario's Action Plan for Healthcare. It's probably one of those documents that I picked up and started reading, and I couldn't believe what I was reading because the statistics and the information in it were quite shocking. And throughout the presentation this evening, I'll be reading just snippets of quotes from it. This one says, for kids aged 1 to 18, almost half of the daily sugar intake, 44%, comes from beverages only. When you think of that, 44% of their sugar, it's alarming in terms of what our kids are drinking. So the genesis of this information fair was based on the International Children's Games to be hosted in our community in August. The Community Planning Committee wanted to develop legacy pieces for our community, focusing on children and youth and their health. So while you'll hear more later from Dr. Ann Snowden about school-age children's initiative called In Sport We Are One, we also wanted to involve our community in a conversation about 3 pillars, and the 3 pillars being nutrition, physical activity, and mental health.
And if we're going to change behavior, we're going to change it at that level. The International Children's Games are 100+ days away. Next week will be the 100-day markdown. 6 days of events, 8 competitions, 2,000+ athletes, coaches from 82 cities, 32 different countries from all over the world will be coming to Windsor and Essex. And as part of the games, there are many amazing stories that gets us excited about these games, and many exciting stories that will be told at the competitive level as a result of these games. But one of the things that we wanted to do was to ensure that we left a long-lasting legacy, not only for the games, not only for this community, but a legacy that can be borrowed by other communities across the world, that they too can share in changing the physical, nutritional, and the health behavior of their communities. So together with our schools, we implemented a pilot program in Sport We Are One, which you'll hear about the health initiative through Dr. Snowden and others. And since October of 2012, the children in the schools have been active participants, led by the grade 7s and the grade 8s. Today, we are very pleased that we are joined by some of our significant partners that are allowing us to take the next level. First, I'd like to recognize Michelle McClure of Ability Online. Michelle, thank you for being here. Ability Online and Michelle have partnered with us, and they have provided the online activity tracking tool. And you can see it at her booth in terms of how it works, but effectively each student is given and has an assigned student ID. They're able to go to the Ability Online website, and they're able to log in onto the website, and through their participation in the activities, and 15 minutes of activity, they're able to insert all that information. That information is tracked by Ability Online, and the competition then is basically administered among the students and among the different schools in terms of how much, how involved, what they did, when they did it, and the total time they spent doing it. To help us even track and standardize, if you will, the programs that are available. I know Ryan Albright is here from OPHEA. OPHEA is the Ontario Physical Health Education Association, and they were very significant partners in terms of allowing and supporting us by providing the resource guide that can be used by all of the students to understand what they can do and how they can do it as they go on to track it. So all in all, the ICG, the International Children's Game, is an exciting opportunity, but the Legacy Project is probably more significant because it is engaging an entire community, and by engaging our community and by welcoming 32 different countries and 82 different cities, they're going to be able to walk away with this concept. And this concept then they will take back to their home communities and implement. And as is known to everyone in this room, because you wouldn't be here otherwise, this type of change happens step by step, one step at a time, but it's important that the first step is taken. And I'm very proud to be mayor of the city, of the community, that's decided not only to take the first step, but to also lead the rest of the world in terms of taking the first step. So on my behalf and on behalf of council, thank you all. Thank you to our partners and our volunteers. And for a guy without a voice, I can still talk, right? I'll cut it off there. Thanks very much, everyone.
Thank you. And just to let you know, there are a lot of medical folks here that would probably be happy to help you with your sore throat. They'll be able to help you out with that. Dr. Ann Snowden is the chair of the Ivy Center for Health Innovation and Leadership. She's a former professor at the Odette School of Business at the University of Windsor. She has roots here. She still lives in the Windsor area. She currently, though, leads a team of national researchers focused on injury prevention for children and has commercialized innovation new safety seat products as a result of this research. That's pretty exciting. She is a member of the In Sport We Are One committee and an advocate for child health. Please help me welcome Dr. Ann Snowden.
Thank you very much, Sharon. It is a pleasure to be here, and I can't tell you what an honor it has been to be on the steering committee for this In Sport We Are One initiative. As Sharon has mentioned, children's health has been a career-long passion for me. I started as a nurse looking after critically ill children and wondered, why can't we prevent children from being so terribly injured in car crashes, which was more than half of the children I actually saw. Hence, working with the auto industry, and what a place to work with the auto industry, but Windsor, Ontario, and getting booster seats and car seats into the vehicles of families and helping make sure they keep their children very safe. So one of my nicknames, particularly in the Southwest, is the car seat lady. I took that work as a car seat lady and worked very hard with Nora Romero and the 4 school boards. And I must tell you, in my several-decade career as a nurse and a researcher, never had such an unbelievable opportunity as having all 4 school boards rally around with many key stakeholders in this community. So really, I'm here just to share my tremendous admiration for this group of partners that I actually really do believe are on the threshold of changing the world and supporting children's health. The future of the world is actually very much about the health of children. Children today in Canada are the future workforce that will keep Canada competitive and economically viable. They are also future caregivers when old people like myself need that kind of help and beg their children every other weekend to be sure they're there when we need it. They are the future of Canada, and this is an initiative that will actually support and drive forward to have a generation of Canadian children who will be able to compete with the entire rest of the world, and I would suggest with this initiative, perhaps lead the rest of the world. So let me share a couple of thoughts on why I'm so passionate about this initiative and where I think its potential really is. As Sharon has already identified, and I don't think there's any of us in the room don't already realize, and I think you've mentioned, Canada's current generation of children is the first in our history as a country who may not outlive its parents because of some very worrisome looking statistics and health outcomes that we are starting to see in this generation. Inactivity, obesity, lack of physical exercise, and mental health are really 3 substantive challenges, and they are all very, very closely intertwined with each other. Relative to other countries in the world, in the economic developed world in particular, Canada, despite being the 2nd most highly educated population in the world and among the most innovative in creating new knowledge, particularly in the health sector, we actually rank quite low in terms of taking that phenomenal knowledge and embedding it into our health and education system to help our children stay healthy. So really the basis for this project and this opportunity is very, very significant, and I am very, very excited about its potential success. That's a little bit of a fuzzy slide, but let me spend a few moments. This is really a legacy project for the Games that began very simply with a group of students at the Odette School of Business who took on the marketing and knowledge-based, evidence-based approach to how do we create a legacy for this project, and where would we start in terms of engaging children in health and wellness and driving their own health and wellness goals. And of course, when students looked at the data, they very, very quickly realized you have to go to where children are. And whether we actually really like it or not, children spend a lot of time in front of screens. Screens of televisions, iPads, phones, computers. So if that's where all the children are, the MBA students decide, well, that's where we need to be. And essentially what they created is what I would call a Facebook version for children's health. It's an online tool. It is sitting on the Ability Online platform, which was originally developed for children with disabilities and special needs. As children with special needs grow older, they actually have greater challenges in engaging with social networks and friends, so they're very reliant on social networking platforms. Ability Online is without a doubt probably one of the most outstanding social networking platform I've ever seen. So with the partnership of Michelle and Ability Online, we not only created an opportunity for children to go online and learn and encourage each other and influence each other on being healthy, we also had the added bonus, which I am so thrilled about, in terms of engaging those healthy children with the children with special needs who otherwise didn't have that opportunity. So when Ability Online partnered with us, they had approximately 1,000 children worldwide on their site with special needs. They now have an additional 5,000 children from Windsor-Essex County, and all 5,000 of those children are their new friends. So imagine 500-fold increase in social networks for children with special needs who thrive on those peer relationships. And imagine the possibilities for the children from Windsor-Essex schools who can go online and do a number of very exciting, healthy, and active activities. I'll just point out 2 or 3 things that are very important in this platform. It's really to achieve 3 things. One is healthy friendships. We know clinically that children who have a wide range of very healthy friendships in their social worlds tend also to be very healthy children. But sometimes that's hard. When you're on the internet and you're constantly being bombarded with lots of information and perhaps threats you otherwise wouldn't be exposed to, this platform was designed to have that safe and secure place to go to build and expand healthy friendships. Why are friends so important? As a pediatric nurse and a researcher, the single most significant influence in a child's health behaviors are their friends, particularly after age 6. So if we can create this environment on a social networking site all about health behaviors where friends influence and compete and engage friends that they might not otherwise, then we see that as a very, very significant opportunity. It's also got a built-in mentorship program, so they can go online into chat rooms with Canada's Olympic athletes. What better way to be inspired to get physically active and eat well and make good friends than from some of Canada's rising stars on the Olympic team? Healthy activities, you probably heard about that a little bit already. Children need to be outside or inside and being lots more active than they have been. That is one of the most significant things we have spent a lot of time focusing on, and OFIA has been an impressive partner in terms of bringing all of their physical health education activities and translating them into digital formats so that children can easily, quickly engage in them and get points to compete with each other while they do that. So that's a very important feature in addition to the friendships. And then third, of course, you notice phenomenal fresh vegetables on every table. And although those initially may not seem like children's first choice, if they're constantly gaining points and influencing each others to eat healthy food, then that again, we're really leveraging that peer influence to drive those behaviors around healthy eating. These are very critical years in children's lives to establish health behaviors like physical fitness and exercise, eating the right foods, building healthy relationships that lay the groundwork for very healthy adulthood relationships and health behaviors. So essentially, I congratulate the In Sport We Are One team. The Passport program is an unbelievable success with 5,000 children. In many of those schools, these children are reporting 100% participation. As a researcher, if I get 50% participation, I'm absolutely over the moon. With 100%, I have to suggest, Windsor-Essex, I think you're on to something in terms of creating an opportunity to strive for greater and supporting children's health. Essentially, I think what it also does, because it harnesses peer relationships so effectively, we're essentially creating what I would call a leadership army. There is no greater influence on friends influencing friends, far more so, as my children remind me almost every week, that mothers and fathers don't really know all there is to know as they should, but friends on a social networking platform seem to be a very important influence. So I would suggest in our school board and our school population here in Windsor-Essex, this is just an incredible opportunity. One of my favorite quotes I'll close with from Albert Einstein was, "Strive not to be a success." Although I must say that the International Children's Games at Windsor are absolutely, have all of the features of success. What's more important is to be of value. And the legacy of this In Sport We Are One social networking platform that mobilizes children, not just in Windsor-Essex, but in all 32 countries who will participate in these games, I would suggest is a phenomenal value that Windsor-Essex can offer the rest of the world and essentially change the world for the world's children. So I wish to extend my warm congratulations. I'll continue to work with Ability Online and Sandbox Group, which is also a very important group. They've assembled all of Canada's eminent researchers around how best to create the opportunities for children to be healthy. Once the children's games are finished, we don't ever want all of this hard work on a networking platform to fade away. It will actually live at the Sandbox Group, and they will literally scale it up and make it available to every province in the country and every country who would like to engage it. So thank you so much for the opportunity to speak with you tonight, and I will be on the sidelines at those games, cheering those kids and those athletes from every one of those countries with great pride of being a member of this initiative. Thank you.
Thank you, Dr. Snowden. OFIA, as you've heard before, is involved and is proud to be part of the 2013 International Children's Games and is pleased to have developed the In Sport We Are One Playground to Podium resource. That's with support from the Government of Ontario. The actual document, Playground to Podium, supports educators, community, recreation leaders in connecting children, and that's grades 1 through 8, ages 6 through 13, through the International Children's Game and a wide variety of physical and healthy eating-related activities before, during, and after the games. So joining us this evening is Ryan Albright. Please come on up, Ryan. Project lead for the Playground to Podium resource guide. And he is going to be presenting the first sets of hard copies to Mayor Eddie Francis and to Directors of Education Joseph Picard and Warren Kennedy. So can I ask those two gentlemen to come on up?
Sure. Okay, everyone. OFIA is proud to be a part of the 2013 International Children's Games and be involved in the In Sport We Are One Playground to Podium program resource. We are really excited to develop a resource that could be used by educators, community, and recreational leaders with the children and youth they work with today. Through this resource, we'd like to thank the support of the Government of Ontario and the support of our wonderful advisory committee that helped get the schools involved throughout our program development process from the needs assessment phase to pilot testing, and we are very excited that we're able to launch the resource tonight. The resource will be available online through the International Children's Games website and is available in both French and English, with the French coming in the coming weeks. So we would like to obviously take the opportunity to present a few of the resources to our guests this side here.
Thank you. How exciting that this has gone to print and available electronically. At this point, we're going to plug into the In Sport We Are One. It's about a 1-minute clip that we would like to show.
What can I do to live a healthy life?
What can we do about our health?
Physical activities. Healthy eating. Healthy minds. Are important to me.
Είναι σπουδαίο για μένα.
Are important to me.
And me.
So I.
Así que yo.
So I.
So we can do better at school.
Can have healthy bones.
One trust.
Have a strong heart.
Meet new friends. Me plus you equals us. Because in sport, we are one.
We are joined this evening with Scott Watson, Executive Assistant of the Sandbox Project. The Sandbox Project is very excited to work with and support the International Children's Game. The In Sport We Are One program will leave a lasting legacy on the health of the entire Windsor-Essex community. The Sandbox Project is determined to make Canada the healthiest place in the world for children and youth to grow up. Living healthy, active lives is an important part of this goal, and we're thrilled to see that Mayor Eddie Francis and the City of Windsor support the International Children's Game with In Sport We Are One, and working towards making Windsor and Essex County the healthiest jurisdiction in Ontario. The Sandbox Project looks forward to continuing supporting the International Children's Game and working in the future to examine the impact of what this type of initiative is having. And does it mean that we're going to be moving it forward to other cities, other jurisdictions, and other provinces? Scott would like to present a check in the amount of $10,000 to Mayor Francis as a commitment to the bronze sponsorship support to the International Children's Games and a firm commitment to continue the legacy beyond the Windsor-Essex International Children's Games. So can I ask both please to come up?